Health economics. Health. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Economics. Economics is the study of wealth. By Adam Smith. Health economics. Health economics is a branch of economics concerned with issues related to efficiency, effectiveness, value, and behavior in the production and consumption of health and healthcare. By Lee and Mills. Health economics deals with allocation of resources between various health activities, quality of resources used in health care, the efficiency with which the resources are allocated and used for healthcare purpose, the effects of comprehensive health services on individual and society. It covers the medical industry as a whole and also extends the economic analysis to costing of disease, benefits of a health programs and returns from investments. How best the limited resources be used on preventive, curative, and rehabilitative services to maximize the health status of a community. Allocation of financial, physical, and human resources between different activity within a hospital. How to promote the efficiency of the health sector. Purpose. To study the pattern of allocation of budget effectiveness and efficiency. To study health expenditure versus health status. Evaluation of health services. Improve collaboration between different administrations. To extract maximum benefits from health industry with least cost combination. Importance. Health and economic development. Planning finance aspect of health system. Health staff planning and demand analysis. Examines the situation where the resources available to us are limited, the alternative uses for these resources are unlimited. Promote efficiency and equality in the healthcare sector by providing analytical techniques to decision makers. Organization of healthcare investment. Terminologies in health economics. GNP is the gross income generated within the country and income received from abroad. GDP, it is the gross income generated within the country, excluding the money from abroad. Poverty line, it is the level of income needed to meet the minimum standard of living. Currently, the poverty line in India is 32 rupees and 47 rupees in rural and urban areas respectively. Per capita income, we also known it as income per person. It is the mean income of people in an economic unit, such as a country or city. We calculated it by taking a measure of all sources of income in the aggregate, such as GDP or gross national income, and dividing it by the total population. Demand, an economic principle that describes a consumer's desire and willingness to pay a price for a specific good or service. Supply, a fundamental economic concept that the total amount of a specific good or service that is available to consumers. Scarcity, when demand overcomes the supply, the scarcity arise. Cost, cost refers to the amount of money spent on health services under the various heads of account. Areas of health economics. Cost of health care. Cost of health care includes all those services or facilities to promote human well-being. Health problem. The study of health economics also concentrates on health as an important economic indicator of economic development. It deals with the correlation between the health industry and economic development. Demand of health care. Demand refers to desire accompanied by ability to pay and willingness to pay for a product or service in a market. The demand may be elastic or inelastic. For example, the demand for medicines has inelastic demand as it is a necessary product which saves life. Supply analysis in health care. Supply refers to anything material or non-material which is offered for sale at a particular level of price and at a given period of time. Supply depends on many factors, such as price, cost of production, government policy, demand, etc. The healthcare services like hospital, dispensaries etc. are all included in the boundary of the study of health economics. It also explains the supply of medicines, services of nurses, existence of blood banks, lab testing equipment, etc. Healthcare services market. The market is an economic environment where buyers and sellers of goods and services interact for purchase and sale for mutual benefit. Market is extended forms local to international and covers almost all the goods, both private and public goods, and services which are consumed directly or indirectly. The scope of health economics explains how the market for health services work. Health plans and outlays. One of the primary motives of every country is to give primary importance to health services to make citizen healthy both physically and mentally. For that, each country prepares its own plan about the possible healthcare programs for human well-being. For instance, we give a percentage of expenditure for the healthcare industry through 5-year plans. Financing for healthcare industry. Financing here refers to money invested in healthcare services. Financing means creation and investment of funds in creating various healthcare amenities. Health economics studies the various sources of finance available for health industry. Optimum utilization of resources. The optimum allocation of resources is an important element of health economics. As every investor or facilitator expects maximum benefit with minimum cost, the resources play a major role in deciding the path of progress. The resources in the health industry include all those men and material used to promote health. The elements of health economics. Microeconomics. Macroeconomics. Microeconomics, that is how individual choose, minimize cost or maximize profit or utilizes within a given healthcare system within a set of rules and prices. Supply and demand influence each other, in turn affect prices. An increase in or oversupply of certain products leads to less overall consumption, decreased demand, and lowered prices. Macroeconomics. It is a study of aggregate national income and expenditure, aggregate demand and consumption, aggregate investment level in both private and government sectors. Cost of healthcare. Demand of healthcare. Supply of healthcare. Cost of healthcare. Cost refers to the expenses incurred by the producer to produce goods and service. Objectives of costing. To know whether a commodity or service is worth producing at a given cost or not. To ascertain the money value of a product. To forecast whether a particular investment should or should not be made. To predict the profit of the business concerned. To see that whether it is possible to produce with the existing resources. Types of cost. Total cost. The various costs related to healthcare are the money the government spends on healthcare facilities, costs of identifying and treating diseases, costs of equipment, costs of building and other facilities, treatment charges, etc. The sum total of all the costs is known as total cost. We divided it into fixed cost, do not increase due to an increase in various functions or activities. E.g., cost of building, cost of X-ray machine, etc. Variable cost, vary with the amount of service rendered. E.g., cost of X-ray films according to number of X-rays taken. Opportunity cost. It is used to describe the loss of the community due to failure to use the available resources or technologies or institutions in the best possible way. Capital cost. Represents expenditure of a capital nature, e.g., expenses for hospital building, machines. Operating cost. These are the recurring expenses which are occurring from time to time in running the program. E.g., for providing required items in achieving the particular task. Marginal cost. The cost of producing extra unit of service. Cost related to health problem. Avoided cost. Cost caused by a health problem or illness which are avoided by a healthcare intervention. Direct cost. Those costs borne by the healthcare system, community, and patients' families in addressing the illness. Indirect cost. Mainly, Productivity loses to society caused by the health problem or diseases. Cost effectiveness. Given output. Cost of illness. The personal cost of acute or chronic disease. This cost may be an economic, social, or psychosocial cost or personal loss to self, family or community. Demand of healthcare. An individual's demand for a good is the various quantities of goods and services that the customer is willing and able to buy at each specific price. The demand for healthcare is a derived demand from the demand for health. The demand for health is unlike most other goods because individuals allocate resources in order to consume and produce health. The healthcare is both a consumption good that yields satisfaction and utility and an investment good, which yields satisfaction to consumers indirectly through increased productivity, fewer sick days and higher wages. The demand for healthcare service is uncertain, irregular, and unpredictable. Illness is costly in itself. When a person is ill, he cannot go out for work and loses pay in addition to cost of treatment. Healthcare industry produces some external benefit, i.e., when the consumer engages in an action it yields benefits to the third party. E.g., immunization benefits the recipients as well as the society by having reduced probability of getting that disease. We offer government health services at minimal cost and in some cases, the government or private organization agrees to pay a portion or full amount of a bill, which is not true for other services. There is uncertainty regarding the outcome. So, the fee given is for a service and not for performance. Factors affecting demand for healthcare. 1. Patient factors. 2. Physician factors. Patient factors. Health status. Demographic characteristics, age, late marriages, educational status. Economic standing. Its importance in determining medical care demand has diminished with the increasing publicity of insurance packages. Physician factors. Physician acts as advisor to the patients and provider of services. Supply of health care. Supply means the quantity of goods the producers wish to offer for sale at a particular price. The government regulates healthcare industry market through agencies like the Medical Council of India, INC etc. to ensure quality. The government subsidizes healthcare costs and education costs. In some cases, the government provides incentives to receive the services. E.g., family planning. Advertising and price competition in healthcare industry are prohibited. We ran a government hospital as a non-profitable organization. Economic evaluation. Economic evaluation is the comparative analysis of alternative causes of action in terms of both their costs and consequences in order to assist policy decisions. Drummond et al. 1997. Types of economic evaluation. 1. Cost minimization analysis, CMA. 2. Cost effectiveness analysis, CEA. 3. Cost utility analysis, CUA. 4. Cost benefit analysis, CBA. Cost effectiveness analysis, CEA. CEA is a ratio of the difference in costs to the difference in effectiveness of the interventions under consideration. When different healthcare interventions are not expected to produce the same outcomes, both the costs and consequences of the options need to be assessed. We can do this by cost effectiveness analysis, whereby the costs are compared with outcomes measured in natural units, for example, per life saved, per life year gained, and pain or symptom-free day. Cost minimization analysis. This approach compares the costs of alternative forms of treatment or management that produce equivalent health outcomes. It is a specific type of economic evaluation in which outcomes of competing interventions are the same, in which the only inputs that is cost is taken into consideration. Aim is to decide the least costly way of achieving same outcome. Cost minimization analysis is an appropriate evaluation method to use when the need for an intervention has been established and the programs and procedures under consideration are expected to have the same or similar outcomes. In these circumstances, attention may focus on the cost side of the equation to identify the least costly option. We regard it as a narrow form of cost-effectiveness analysis. Cost-utility analysis. A special form of cost-effectiveness analysis measures the effect of an intervention on health units that measures both quantity and quality of life. Measures the quality of life, not just the numbers of years lived in a particular health state. E.g., QALY. Cost-benefit analysis. Here, the benefit is measured as the associated economic benefit of an intervention and hence both costs and benefits are expressed in monetary values. In cost-benefit analysis, CBA, costs and benefits are both valued in cash terms. It provides a broader comparison between alternative programs. This allows to assess whether the program is economically sound or worthwhile. Cost containment. The process of controlling the expenses to operate an organization or to perform a project within pre-planned budgetary constraints. Strategies. Reducing need for services. Primary and secondary prevention. Health promotion and education. Patient safety and reduced medical error. Modifying consumer demands. High deductible plans, low monthly premium payment and increased amount the patient has to pay for care. Progressive cost sharing, sharing the cost of care by insurer and patient. Modifying providers' behavior. Pay for performance for reimbursement based on the quality of structure, process, and outcome standards of care. Bundled payment, providing the healthcare provider with the cost of healthcare of a patient for a specific episode of care as a single payment. Instrumental measures. Electronic health record. Clinical effectiveness and cost-effectiveness research. Family budgeting in health and illness. A family spends its money effectively to safeguard their health and welfare. The family can practice health economics in the family in the following ways. Obtain health insurance. Follow healthy lifestyle. Seek consultation from healthcare provider, when ill. Routine immunization. Economics of illness in the family. When serious illness or disability strikes a person, the family as a whole is affected by the disease process and by the entire healthcare experience. Patients and families have different needs for education and counseling. When a family member becomes ill, other family members must alter their lifestyle and take on some of the role functions of the ill person, which in turn affects their own normal role functioning. Factors influencing economic problem. The extent of family disruption depends on the seriousness of the illness. The family's level of functioning before the illness. Socioeconomic considerations. The extent to which other family members can absorb the role of the person who is ill. Steps for good home economics, cost containment strategy at home. 1. Record expenses. 2. Make a budget. 3. Plan on saving money. 4. Set savings goals. 5. Decide on priorities. 6. Different savings and investment strategies for different goals. 7. Make saving money easier with automatic transfers. 8. Watch your savings grow. Record expenses. The first step in saving money is to know how much you're spending. For 1 month, keep a record of everything you spend. That means every coffee, every newspaper, and every snack you purchase for the entire month. Once you have your data, organize these numbers by category, for example, gas, groceries, mortgage, and so on, and get the total amount for each. Make a budget. Now that you have a good idea of what you spend in a month, you can build a budget to plan your spending, limit overspending, and make sure that you put money away in an emergency savings fund. Remember to include expenses that happen regularly, but not every month, like car maintenance checkups. Plan on saving money. Taking into consideration your monthly expenses and earnings, create a savings category within your budget and try to make it at least 10 to 15% of your net income. If your expenses won't let you save that much, it might be time to cut back. Look for non-essentials that you can spend less on, for example, entertainment and dining out, before thinking about saving money on essentials such as your vehicle or home. Set savings goals. Setting savings goals makes it much easier to get started. Begin by deciding how long it will take to reach each goal. Some short-term goals, which can usually take 1 to 3 years, include starting an emergency fund to cover 6 months to a year of living expenses, in case of job loss or other emergencies. Saving money for a vacation. Saving to buy a new car. Long-term savings goals are often several years or even decades away and can include saving for retirement, putting money away for your child's college education. Decide on priorities. Different people have different priorities when it comes to saving money, so it makes sense to decide which savings goals are most important to you. Make saving money easier with automatic transfers. Automatic transfers to your savings account can make saving money much easier. You choose how often you want to transfer money and which accounts you want to use for the transfers. Watch your savings grow. Check your progress every month. Not only will this help you stick to your personal savings plan, but it also helps you identify and fix problems quickly. With these simple ways to save money, it may even inspire you to save more and hit your goals fast. Responsibility of nurse. 1. Teaching. Make the family part of your teaching plan. For example, if your patient's wife does all the cooking in the home, it is vital to include her in diet teaching. Involving family members may be an important future source of support for the patient as he or she works at behavioral change. 2. Counseling. 3. Recognize changes. Long-term illness, even in the most stable and supportive families, brings changes in family relationships. Illness produces disequilibrium in the family structure until adjustments can occur. If the nurse does not recognize the change, what it might mean to the patient and family, and how it might affect the patient's willingness and ability to carry out healthcare recommendations, the goals of the teaching process will be diminished. 4. Identify patterns of relationships. When teaching the patient and family, it is important to identify patterns of relationships and to be alert to attitudes of family members. You may be able to identify resources within the group and help family members mobilize their resources to help the patient. 5. Identify resources. A nurse may be able to identify resources within the group and help family members mobilize their resources to help the patient. It's also important to be alert to some of the factors in family members that act as a barrier to education. Illness in a family member tends to raise the anxiety of all those close to the patient. Please like, subscribe and click the bell icon. Thank you for watching video.